Okay. Hopefully that one works better. All right. So with the DC Public Health Association, this year we did do a lot of things. So this year we partnered with the Special Olympics DC with the Summer Games, and we were able to give them a donation and help with the Summer Games. So that was a good thing that we did. Year is that we had a new secretary come in. Her name is Stephanie Rowland. She's not able to be here today, but we did want to recognize her as well. We also elected a new president-elect. Her name is Tresmeja Stewart. There she is right there. Yes, yes, yes. And a big thing, which if you are any student of mine, we are hosting the American Public Health Association annual conference here in Washington, D.C. That is going to be November 2nd through the 5th here at the Convention Center. So it is a big thing that we are doing. We are partnering with the Virginia Public Health Association, and we are partnering with the Maryland Public Health Association. So if you want to come out and come to the conference, please come out. That is something that we are doing. Another big thing that we did this year is to partner with the Pahoehoe Credit Union. So we do want to have them come up and say a couple remarks about that partnership, and please watch your step.
Thank you. Good evening, everyone. It's a pleasure to be here, and thank you, DC Public Health Association, for inviting us to talk to you very briefly about the credit union. My name is Michael Ray. I am Vice President of Organization Development at the credit union. Along with me is my colleague, Esteban Azer. He is the Vice President of Operations. We were invited to speak to you very briefly about the benefits of belonging to the credit union. As members of the association, as of October, you will be able to join our credit union. Our credit union is, the headquarters is in Arlington, but our branch is in Fargate Bottom. And we wanted to make sure that you are aware that upon membership into the association, starting October 1st, you can open an account with us. We're not as big as many of the banks that you probably are using at the moment, but nonetheless, our philosophy of what we do is that is helping people is at the core of what we do. So we welcome your participation into the credit union. Pretty much all the services that you can obtain at Chase or Bank of America, you can do that at our credit union. We are people helping people business, and that is what sets us apart from other financial institutions. We're very excited about the partnership. We think it aligns with what you do as professionals. The core mission of what we do is the core group that we serve is Pan American Health. They're in the business of research and making health available to all people in the Americas. That includes the United States and Canada. Our business is to help our members to financial wellness. And we do that by offering products and services that are affordable and certainly that can be useful for not only yourselves, but your family as well. Once you become a member at the credit union, you can extend membership to your immediate family, and they in turn can do the same for their families as well. So we're very proud of the fact that we have just about everything that you can do online with the banks that you may be banking at, but the fundamental difference is our service. And we're here for all of our members, and we want to help our members to be financial stewards of their finances and get to a point where they don't have to worry about, you know, bills and those kinds of things. We offer those products to help you with those things. So um, I know you have a full discussion tonight, but if you have any questions about the credit union, certainly let us know. And I think that's pretty much it.
Awesome. Thank you so much. So hopefully everyone online can still hear us. All right. So thank you everyone again for joining us. And we are going to get started with our panel discussion. Before we get started, I did want both of our panelists to introduce themselves and just tell a little bit about their background, and we'll go from there. So I'm going to start with Shawn to go first, and I'll turn on your mic for you.
Are we set? Hello, everyone. I promise that wasn't me. It was my interpreter. We have to put all the blame on the interpreter. I want to give a brief visual description. I am a white queer person sitting here. I have dark brown curly hair. I'm wearing a black shirt with a gray vest. My pronouns are they, them. And I'm very excited to be here with all of you and to get to talk with Shawn in terms of navigating the experiences of healthcare. We know that healthcare is supposed to and is intended to support and help people, but oftentimes people with disabilities are overlooked. And that's something we'll be talking about today. The interpreter's following me so far? Okay. To give a little bit more information about my background, I now work with Deaf Health, which is a division of CSD, Communication Services for the Deaf. That is a national organization. It's a 50-year-old nonprofit with the explicit intention of supporting people with varying levels of hearing loss, whether they be deaf, hard of hearing, or have other identities. And the focus is on their access and improving their quality of life. Deaf Health specifically provides health and patient advocacy services. And it's been an honor to work with my colleague, Alyssa Ditmar. Really, Alyssa is a phenomenal person. She was originally the person who was supposed to be here for the panel. I needed to sub her out, and I will do my best to fill her shoes, but it will be impossible to fully do so. My work in health and healthcare started more than 15 years ago. I started working as an educator, teaching health specifically. I lived in Texas. Well, let me back up and explain. I grew up in Pennsylvania, then I moved to Texas. I moved to Minnesota. I worked as a community health educator, specifically focusing on sex education. I am a certified sex educator. And then I moved here to Washington, D.C. as of 6 months ago, relatively new to the area, working and doing advocacy work in healthcare. I am also a certified medical interpreter. And you might not have thought about that and how that works. And I will explain to give you a bit more context. I am a deaf interpreter more generally. And to try and give you an example, if you're listening to someone who is speaking your native language, but it is their second language, there may be times you could misunderstand them, right? There may be some words or nuances that are missing, and you may be working quite hard to understand what is being said. And when that happens, that can mean that you don't have 100% presence with people, especially if that is in a healthcare setting. When you come into a space where you are a patient and very anxious and then have to worry about the interpreter understanding you. When I am not working in deaf health as an educator or advocate, I work as a deaf interpreter, and that allows deaf patients to relax and more fully have communication in their native language, and I'm able to connect with them and communicate more effectively. You may notice me looking at my phone from time to time. I promise you I'm not texting during this. I'm just looking down at my notes. I have ADHD, and there are times where my brain is going faster than my hands. So I'm just looking down to make sure I don't miss anything important to share with you.
Okay, so we're going to use the same mic because that mic, we couldn't really hear Shawn's introduction online. So we're going to have you do a little brief reintroduction, Shawn, when I asked the first question about being an advocate. So tell us more about your role as an advocate. So I will hand you the mic, and then if you can give us a brief little reintroduction for those online. So here you go.
Great. Again, my name is Shawn Callaway. I serve as president of the National Federation of the Blind of the District of Columbia. And I also serve as a member of the board of directors of the National Federation of the Blind. The National Federation of the Blind is an organization that advocates for the civil rights of blind people, basically, right? So one of our, of course, we advocate for so many things, education, employment, a whole lot of things within the social arena, but definitely one of our biggest sticking points and one of our biggest hills is the healthcare professionals profession, right? I can't tell you, and it's unfortunate that within the United States, how many blind people have their children taken away after they had their baby, right? Because of their blindness. This is not an uncommon occurrence. It's happened quite frequently and too many times, quite honestly. So what we do as an organization is as we advocate for that parent to have their child returned to them. Too many times, people have lost their children, or their children have been taken away based on assumptions, right? Because oftentimes we've had blind couples who have had a child. And so there have been healthcare professionals who have questioned, how can a blind person care for a child? And so therefore they will call Child Protective Services, right? And this is where what we call ignorance comes in. Oftentimes ignorance basically means you don't know, right? You have no idea or clue about the capabilities of blind people, so you will make assumptions about what we can and cannot do as blind people, especially as blind people as being parents. And so I think from a healthcare professional standpoint, I would say this is one of our biggest fights within the field. Look, the whole discussion about blind etiquette and disability etiquette, we'll be here all night talking about that, because that's pretty prevalent as well, sort of the lack of etiquette within the profession. So I'm going to be honest and blunt in regards to what I've seen and dealt with. And so I think that will be very beneficial to you all, especially those of you who are in the healthcare profession. So.
Thank you.
Really, I want to echo what Shawn has said in terms of the ignorance. One of the biggest things that I've learned as an educator is, well, I've had students come and ask me a question, and there are times where I don't know the answer, and I say, let's find out together. And that practice is something that should be incorporated in healthcare much more often. When we have a situation we encounter that is unfamiliar, that we don't know, if a healthcare provider sees and meets a patient with different identities or disabilities, oftentimes they shut down when they don't know, but they need to instead leave space to jump in and say, this is not familiar to me. Can you tell me what works for you? Bring in resources, leverage the resources that you have. I also think one of the biggest misconceptions around disability is the assumption that our disabilities, our identities, our needs are stable and the same. And if you need one thing, it will always be the same thing, even 10 years later. And that's often not true. We are human beings. Our bodies are constantly changing. We see that all of our cells in our skin are completely replaced every so often. We are new people. And we need to make sure that healthcare providers are understanding the evolution of patients. We need to look at how technology can be used for the benefit of patients as well. Yeah.
Thank you. So looking at the role of the medical professionals and awareness, and given that many of the individuals in the room are in the healthcare or healthcare adjacent field, how can medical professionals and individuals in the adjacent fields be better trained to identify and understand disabilities that may or may not have outward signs or symptoms? So I'll give it to you, Shawn, first.
Well, it's about, again, it's about awareness, right? I'm not sure what courses students are taking before they enter the workforce. One of those courses needs to be something on disability awareness, right? I remember being a social worker across the street over at Catholic University, and I don't remember having a course on disability awareness or something dealing with blind people or any form of disability at that time. I think, and quite honestly, there are programs now. There are certain schools across the country that are, especially dealing with doctors, that have programs that teach them how to engage individuals with disabilities, especially in the intellectual and developmental disability programs within the Department of Health and Human Services that I'm aware of, right? I think it all starts, I always tell people all the time, disability awareness should start in elementary school, quite honestly. It shouldn't start when you join the workforce, right? When you're trying to figure things out. Again, we would use the word assumptions and ignorance throughout this panel discussion, because that's what it is, right? This is the only way you're going to learn about people with disabilities is, number one, if you interact with them, but also take the time to learn about the history in regards to us as people with disabilities. I think this panel discussion is perfect, right? Because we're going to give you a sort of a personal experience on what we dealt with in professions that you're going into. I mean, I'm gonna be honest, I've dealt with some insensitive nurses. I've dealt with some doctors who said some insensitive things, and you know, and it also trickles down to the staff within the medical office as well, right? I mean, even to the person, the receptionist. I can't tell you how many times I've dealt with a professional who will say, "You're here by yourself?" Well, somebody should be with you. I mean, they're telling me that I'm a grown man. You telling me somebody should be with me? That's unacceptable, right? So I believe personally, um, the discussion about disabilities before you enter the profession, after you graduate, should start in school. You should have these discussions. And when I say have discussions, I mean courses should be offered in regards within your programs, right? Not just with, you know, I don't want to put the dean on the spot, but, you know, not just panel discussions, right? And this is I'm saying this for colleges all across the country. This discussion needs to be had throughout a whole semester, if not a whole calendar year for in regards to academics. So.
Yes, very much so. And that's definitely why we partnered with Special Olympics to include, we have Special Olympics to have health inclusive lectures that they would come into a lot of the professors' classes and give these lectures about ID populations. But yes, definitely more courses as a standard, and it should be a general education course.
Absolutely, completely agreed. I remember growing up always having the separate classroom, the special education classroom, and it was not cool to hang out with the kids in the special education class, or not cool to hang out with the deaf and hard of hearing kids. In my community, there was a self-contained classroom, so at a public school, but for deaf and hard of hearing students. But then there was a special education class separate from that. And the level of segregation for many special education students harmed our community. And looking at folks who are called able-bodied and folks who are disabled, and the people who are able-bodied out there oftentimes don't want to interact with people who are disabled, but people who are disabled interact with able-bodied people every day. And it's really important to understand the way that we experience ignorance and rudeness and terrible attitudes every day in restaurants, at airports, everywhere we go when we engage with the public. And of course, this flows into healthcare as well. My 2 cents on this in terms of healthcare is, of course, more trainings and courses can be provided, and engaging with communities is also very important. But also hire people with disabilities to work with you in the healthcare field. That will make the biggest impact. They know what the community needs. It's important. I know oftentimes hospitals or clinics will have disability services coordinated with one person. Build relationships with them. Oftentimes the disability services coordinator works to serve people with disabilities, but they will be able to work better when other people know what is happening and when other people understand the needs of various disabled folks. And then the service that's provided is provided immediately, as opposed to if they've never had this experience before, then you have this latency where we see that disabled patients are the ones that suffer. So an organization or service that provides any kind of disability access should be ready to go and provide support immediately when a patient comes in. I also wanted to mention that oftentimes there's an attitude that disability access services takes care, quote unquote, of the disability community and disabled patients, and then other folks don't want to deal with it. Healthcare professionals don't want to deal with, for example, interpreters with deaf patients, or other folks who come in who use a language other than English. And when we think about those after visit summaries, for example, they're almost always only provided in English, and they're rarely understandable for folks. So it also is not written in lay people's language. So there's a lot of medical jargon, and it can be exhausting for folks to understand that content. Why not make it more visual or more understandable for different folks with disabilities to understand, especially when they need to take their medication? If you added more information that's easier to read, that's more visual, then you're going to guaranteed have better medication adherence.
Thank you. So still sticking on the role of awareness in education, what are some of the common challenges that you or some of the individuals that maybe in your community face when it comes to educating healthcare workers or those in the healthcare setting about your specific disability?
As some of you all enter the workforce, one of the biggest complaints you're going to have about yourselves is the lack of time to do things. I think that one of the organizations I'm very appreciative of is an organization called the Prevention of Blindness Society. This is a organization that's filled with ophthalmologists and optometrists, right? And they actually take the time to have seminars, yearly seminars and events in regards to blind awareness, right? And so, I mean, my biggest, I would say, challenge is that some of the health professionals willing to take the time to sit down and learn about blindness and other disabilities, right? I don't think it's that hard to gather some folks together to have this very fruitful discussion, especially if you care about the population that you serve. I believe, and my panelists can, fellow panelists can vouch for this. I believe over 20% of the country is designated as persons with disability. That's a lot of people. And so the idea that we're still trying to deal with sort of the attitudinal barriers in regards to, again, and it's always about the question of capability, right? In a lot of cases. And again, we always go back to that word ignorance, and sort of not understanding us and how we, sort of deal with society as a whole. So I would say if there is a challenge, it's just really just taking the time to learn and understand us as person with disabilities. I mean, I don't want to act like I know that, every sort of meeting or seminar that's going on in the country, but I just don't see enough of the discussion. And there are some. I don't want to say there's not any, but I just personally believe there needs to be more discussion, especially after graduation, right? That it needs to be ongoing, just like we all need to get CEUs. And as I'm a social worker, licensed social worker. I think that it should be required that you should, one of your CEUs should be in disability awareness, right? Or whatever your licensed profession asks for in regards to you know those units or courses that you need to maintain your license. So, but I would say for me, the biggest challenge is just getting the healthcare professionals together to really just have a sort of a positive dialogue on how we can be treated better as persons with disabilities.
Thank you. So the prevention of blindness, they actually have internships as well. So yeah.
This is B speaking. There's a misconception that, thinking about how best to respond to this, a person deserves access to information in a language that they understand. Oftentimes people think, well, there's an interpreter, then the interpreter is taking care of it. But that's not enough. And when interacting with a person who is deaf, then they'll say, oh, right, I've worked with another deaf person. I know how to work with you, and deaf means deaf. No, it does not. As we've talked about, people's identities change, but also individuals with the same disability are different people, and one size does not fit all. It's important to lean in and check in with each individual patient to see what will be most effective for them in a given health appointment and understand what they need. I've heard many stories where deaf patients are really pushed to the side and ignored. Oftentimes, if there is a deaf child going to their own doctor's appointment, an interpreter isn't provided, saying they're young, it's not important for them to know what's happening, and the doctor will just talk to the parents. And the child has no type of assent or consent in that situation. They don't know what the nurses and doctors are doing. Oftentimes, the healthcare providers will touch them without consent. Can you personally imagine someone coming in and touching your body while you don't understand a single word they're saying, or why they're giving you a shot, or what is in it? Imagine having that experience your entire life. That is the reality for 90%, if not more, of deaf and hard of hearing children. They have hearing parents, and it's not bad that their parents can hear. The problem is that most of the parents of deaf children, and I use the word hearing by describing people who don't sign and can hear, so you all in this room are hearing. When parents have a deaf child, the healthcare system is designed to tell them the best thing to do is to just teach that child to speak and hear, and to actively not teach that child to sign. And the healthcare profession encourages those parents not to sign, right? You all learned to speak and hear, and you use your ears to learn. But if you can't hear, that makes access to learning to speak harder. The reason you learned to speak was because you could hear speaking happening. That creates language deprivation for a deaf child, which has lifelong impacts. Many deaf people have had language deprivation and don't have language at all until maybe, if they're lucky, they get access at school at 5 or 12 years old. Some of them never have language. I worked with a deaf patient who moved here from another country. And the US is considered the best country for deaf and hard of hearing people because of the laws that we have protecting our rights and giving us access. Many other countries don't have those same rights. That is something to keep in mind. In interacting with a patient who had immigrated here in their 40s, we were attempting to have a conversation, and the patient said that they didn't understand why they were bleeding every month. And I explained to this 40-year-old why she was bleeding every month. Can you imagine a child at 11 or 12 who has no language access, who has no idea this is going to happen, and then they see blood? They assume that's not a good thing. That child may freak out, and their family doesn't communicate with them and isn't able to use language to communicate with them. Oftentimes, deaf people feel very disconnected from their own body. They don't understand how their body works. That is an incredibly difficult issue and needs to be addressed. Again, there's a range of experiences for different disabled folks, people with different levels of hearing ability and hearing access, for deaf people specifically, you don't know what your patient will know or not know when you interact with them. And when you're interacting with a patient, you need to check for understanding and not saying, do you understand, where they have to give a yes or no answer, but asking clear follow-up questions and showing your concern for them. Connection is important. You should be trying to connect with each of your patients. And when you show that you care and you're not just there to make money, you're not just there for a number, but you are there to care about the patient, that's important. And that's why you're here today, right?
I wanted to piggyback on that because I wanted to bring up an example as well. And this is a problem in society as a whole. You know, there are not a lot of blind people in this country, right? So many people don't interact with blind people on a daily basis. So oftentimes blind people, when they need information, a lot of blind people will want their information in Braille. There have been fights with healthcare professionals in regards to making sure that that person gets their information in Braille. Now, we kind of know that you're not going to have it immediately, right? But we ask you just to make an effort, right? If we request our information in Braille, you know, try to make an effort to give us our information in Braille. There are blind people. I know this is a shock to some people who are listening online, but you know, there are blind people who do live alone, right? There are blind people who live independently, right? So if we ask for the information electronically, or if we want the information in Braille, it should be done, right? And a lot of the sort of the lack of transparency really comes from healthcare companies per se, not necessarily the doctor's office, but in regards to requests for information. But a lot of healthcare companies, for some reason, they just don't want to provide that information that we ask for in Braille. I don't know why that's a problem for them. It's always it's like, well, you know, we don't deal with a lot of blind people, so you know, we don't want to set a precedent. I just don't get it. It just doesn't make sense to me. But we've had to advocate and fight, you know, that we can get our information in Braille, or we can get our information electronically as well. So those are additional challenges for us as blind people.
Yes. That type of thing, it feels like it should be common sense. Making sure that information is available in accessible formats. When patients go somewhere to get care for their bodies, they should be able to understand it. There was a situation that came up where there were a number of deafblind patients. I've worked with several. And there was a patient who went in for a breast cancer screening and had a biopsy done. And this person had been deafblind their entire lives. And when they said a biopsy was going to happen, the deafblind person was asking what and where and how that was going to be. And I was there as an interpreter and was asking the nurse, do you have any tactile models that we could use to show where and how that would happen? And the nurse had no idea how to handle it. The nurse said, no, we don't have anything. We have some visual things, but nothing tactile. And of course, as a health advocate, I don't want to be touching this patient's body without consent. And really, it's not appropriate and not my place. But she wanted to understand where this biopsy was going to be happening to be prepared. So in the moment, I ended up grabbing one of those kind of cartoony clay things and molding it like actual tissue paper, to mold it into something that would be like that, and then use my hand, and gave a basic tactile example. But there needs to be toolkits, as has been mentioned before, for a number of reasons. Maybe not just for deafblind or blind patients, but for any person, or a person with autism, for example, being able to accommodate folks with lots of different lived experiences. And when you don't have those materials ready to go, the message you're telling patients is that they don't matter and that they don't belong. That's the message that we've been getting our entire lives. And you don't want that message in your exam room, right? You want to be able to show every patient that they belong, that you are ready for them and you are ready to care for them. We need to change the messaging that's out there.
Thank you. And what I liked about the interpreter services that we are currently using is that he specifically wanted to know what B wanted. And that was very important. And even when the interpreters came, I was asking specific questions and they immediately stopped me and they said, "We're going to wait for her." So that was very important for them to say, we know we want these set up how, that's important for her, even though, we want it to be set up for those online as well, but making sure that B is comfortable. So that was super important. I just want to make note of that for those in the room that are interpreting for us today. So, yeah. Moving to technology and innovation. So, with the advancements in medical technology and AI, which no student in here is using AI in a bad way for any of their papers or anything else. How do you see innovations helping to better identify or treat conditions? So,
I have to ask her that.
no, okay. Yeah, maybe? Okay.
Sort of not just AI but medical devices. Remember? Yeah. I think, for example, the National Federation of the Blind is actually advocating on Capitol Hill with a bill called the Medical Devices Non-Accessibility Act. A lot of devices for us as blind people are not accessible, right? I have a CPAP machine that is not accessible. There are glucose machines or devices that are not accessible. High blood pressure machines that are not accessible devices for blind people. So I think you see these devices that are being made, and clearly blind people are not on their minds when they make these devices. I mean, we can go not only medical devices but many other devices, ovens, stoves, things like that as well. But definitely medical devices, we are behind the 8 ball as blind people in regards to having multiple devices that are accessible, medical devices that are accessible to us as blind people. And this is what one of the main things we're advocating for on Capitol Hill. I hope it gets better. And I hate to, sound like the gloom and doom guy, but at this point, for us advocating for this in 2025 is a problem, right? And so I'm sure AI will be assisting with this one day. Hopefully we can, get to the device itself to make it accessible. But we're just surprisingly far apart in regards to, inclusion and making sure that, these devices are accessible for us as blind people. So that's where we are in regards to medical devices.
Technology. We have a love-hate relationship, right? I think it's fascinating how we are quick to innovate and create lots of technology, but then realize as an afterthought that it's not accessible. And that is a theme in our lives. I'm not sure, Shawn, if you agree, but I feel like, right, I always think, oh, I must be an afterthought, where we are not the priority ever. Things have to be adapted for us after they've been created, instead of from the beginning making sure that a device can be used by many different communities. that is inclusion, when you involve communities in the process of creating something. Now, telehealth has become more and more popular thanks to COVID, I guess. But telehealth has a number of benefits, but there are still gaps. When we think about digital literacy, how many people really know how to use these platforms and who doesn't? The healthcare system is not prepared to provide any of that training or support for digital literacy of their patients. And then the patients feel frustrated, and then the healthcare providers feel frustrated. Their platform's not being used, but the patients feel frustrated. They don't have the option to go in person and get care. Telehealth gives many opportunities, but only if it's accessible and equity is a priority. Sometimes, not just sometimes, but oftentimes when deaf patients use telehealth platforms, they can see the interpreter, but they're concerned about confidentiality. How do they ensure that the interpreter is in a room alone where their medical information isn't being overheard by other people? An interesting thought as well is that these video platforms, the video conferencing platforms, I feel like were taken from deaf people and deaf people's innovation, because we used to use what were called TTYs, teletypewriters, where we could make phone calls back and forth through typing. And then eventually, when there was video technology, we created video phones to be able to call other people through video and have conversations in sign language. And that happened when I was in like 8th grade. I'm not going to give my exact age, but that happened quite a while ago. And then later, the larger community found out about it and then adopted it. And now video conferencing is used for the general population. And then eventually it went to telehealth. And deaf people are like, hello, this is what I've been trying to tell you to do for decades. And that's another frustration as well, when the deaf community sees something that works and tries to get the larger society to adopt it, people won't. But then at some point they realize the benefit of it and will use it, but they will only use it if able-bodied people will see the benefit of it.
Thank you. So looking at the stigma of disabilities, what steps can society take to reduce the stigma associated with disabilities, both within healthcare and in the broader social setting? All I heard was sheesh from Shawn.
Yes, boy, the National Federation of the Blind was established in 1940, right? That's about 85 years, if I'm not mistaken. And we still dealing with the same stuff. Again, how do we deal with stigmas? I think, you know, the media needs to do a better job in presenting us as blind people and persons with disabilities, right? Somebody asked me the other day, is Stevie Wonder the face of the blind community? I mean, I quite honestly, I had to think about that, right? Because to the mainstream, he is. But to us as blind people, I don't know about that, right? Oftentimes, I'll never forget, I was in Baltimore. I was going to school, and it was the big snow back, I was thinking 94, 95. And I'm standing outside and in this snow because I'm catching the bus to school. And someone sees me and they says, well, you know, hang in there, brother. Think of Stevie Wonder. So I'm like, what the hell I'm gonna think about him while I'm standing out here in the snow, right? I say that because, you know, people perceive, Stevie Wonder is one of the most independent people I know people who know him. I don't know him personally, but he's one of the most independent person that you would ever want to meet, right? But all people see with him is that he's always with someone. So they assume that that's how we live, that we always had to have someone with us, right? Remember I told you at the beginning when I've gone to doctor's offices and they said, well, you by yourself? How come you're not with someone? As if I need a caretaker to handle my business. But I think, and I think my fellow panelists will give a better answer than I will in regards to eliminating stigmas, right? But it's, I mean, again, I've always said, again, and I said it earlier, the education should start early. It should start very early in regards to, you know, us as persons with disabilities, right? To learn about our capabilities and how we can do certain things. I mean, again, it all surrounds assumptions. And as professionals, I pray when you go into the workforce, don't make assumptions about what a person can and cannot do. Just ask. I think, you know, if you, well, y'all, I'm sure y'all old enough to understand that what happens when you assume, right? Okay. All right. So and that's true, right? So I'd rather you ask than make an assumption and then our interaction goes haywire, right? There are some people who do get a little irritated if you ask them a question about, you know, how they do a certain thing. But if you don't ask and you make an assumption, it could get even worse, right? So I would just say for me about the stigmas, just, you know, I just believe society has to do a better job, especially from a media standpoint, in regards to presenting us as persons with disabilities, especially as blind people, right? We can go back 60, 70, 80 years about the blind person standing outside with a, you know, with a teacup and, you know, and that's how we were kind of viewed as. We weren't viewed as professionals, college graduates, married, raising children, because we do these things now, right? And I think that needs to be presented big time. I'm gonna say this, I'm gonna leave you with this one. There's a wildly popular show called The Breakfast Club. And back in 2019, I'll never forget it. There was a young lady who came on the show who was blind. And, you know, they have this segment where if you want to call and complain, you can make a complaint. And so her complaint was that she wanted to babysit for a couple, but they didn't want her to babysit their children because she was blind. And so these hosts of the show basically made fun of this young lady, basically saying, well, you're blind. I wouldn't let you watch my child either, right? And they use that show to, you know, have people call in. Would you have a blind person watch a child? Not asking the question to the audience, if you're blind, could you call in and let us know how you're able to watch a child, right? And I'm not gonna lie, I was out as a father. My daughter's 10 now. That happened when she was 5. I was pissed off, right? Because here you are marginalizing us as persons with disabilities or blind people, but you're a show that promotes the upliftment of marginalized people. So we were being marginalized by marginalized people. It makes no sense. So, you know, that's why I say it really, you know, and the media is a big part of that. I mean, y'all know this, social media and all this other stuff. I mean, people really, you know, they swear by that stuff. And so I think if we have a positive message and a positive presence in the media space, that stigma, it won't evaporate, of course, but it can definitely help tear down some of those walls. So.
Thank you. Thank you.
It's a loaded question talking about stigma. And I don't think I can answer it better than you can, Shawn. I disagree. I do agree, though, that our society needs more exposure and more media representation of disabled folks. And also, it's not just about what's in TV shows or movies, but oftentimes when there are characters with disabilities, they aren't hiring people who are authentically disabled. So often they're bringing in people to pretend like they have a disability, but really we need to be hiring with people with disabilities to represent themselves. And when I finally see shows or movies where there will be an actual person representing themselves, for example, a deaf person, the whole focus is on their deafness. And that is very frustrating. There are many parts of our identities. For me, being deaf is one of them, and to have an entire show focused on that is very frustrating. As you interact with different patients with disabilities, don't just focus on their disability, focus on the person, the whole person and who they are, their personality, what they're bringing, why they're there. When we talk about stigma as well, I'd like to talk a little bit more about thinking about bills and legislation that are written to protect people who live in this country. We do have laws that have passed to protect our right to exist. And these bills are now in a number of states being tossed out. And what we see is that a number of protections are going away. So that means depending on the state I'm in, I will have different levels of protection. So myself and my friends have been looking at moving to states that are safer. I moved here to DC, but I've lived in Pennsylvania, Minnesota, Texas, California, and I consider myself a transplant. And I'm sad to say that the move to the DMV, DC, Maryland, has been terrible in terms of my healthcare access. DC and Maryland has been the worst level of access that I've had from anywhere. I've had to reschedule appointments 3 times with one clinic because they refused to provide an interpreter. And having to fight with them was incredibly frustrating. And I am someone who has full access to language. I am bilingual in written English and ASL. I work in the public health field. I am a huge advocate. I'm an educator. I'm pretty good at communicating with people, and I'm experiencing this with all of the privileges and access that I have. I can only imagine people with other marginalized identities who have less language access and what their experience is. Oftentimes people then just give up. And it's been shocking to me from everywhere that I've lived, seeing that the experience here is so terrible and recognizing that we need more legislation to protect ourselves. And oftentimes to get those bills to become laws, we need data, which means we need research. When you look at data, there's just not enough of it on various healthcare focused specific areas, talking about deaf people or other people with disabilities. There's not sufficient data to show the disparities. And without that research, it's challenging, or they begin to do that research, but they don't include people with disabilities, and then the data is inaccurate. And it's overwhelming trying to think about where to begin. But Shawn's right, this education needs to start in elementary school, and you need to make sure you have people on your team with lots of different identities who are going to make sure those identities are represented well. I feel like I've been saying this for my entire life, but yet it is still time to center our voices, make sure we are included, and ensure that laws are not just pieces of paper, but ensure that those laws are a work in progress and something that are enforced.
Another thing too is that just to mention the including individuals with disabilities on the team when it comes to research, because if they don't feel comfortable talking to someone that looks and feels and is like them, then they may not be willing to provide that data to that person. So that's another barrier to getting that data. So that can be another issue. So we're coming to that wrapping up point. Any questions for our panelists? Okay.
Thank you so much for sharing your experiences with us today. It's so wonderful to have not only the breadth and depth of what you offer from your own lived experience, but also being able to share other people's experience is really powerful and compelling. And I so appreciate you sharing so many stories today. I help operate 12 safety net organizations in Montgomery County that serve people who don't have health insurance. And we have, actually, it's more than that. We have 12 for adults, and then we have about 20 for kids. And it sums up to 50 different sites of care serving 35,000 people who are uninsured. And so I'm wondering if you had recommendations for us on what are, if you could give me a list of, if you did these 3 things, it would make such a difference for the disabled community. What would those 3 things be in terms of making sure that they're able to access care?
Thank you.
Shawn, would you like to take this one first? Darn it. I empathize with wanting a recipe of sorts to be able to resolve it, but that's actually a really hard question to answer. I don't even know the top 3 issues, and I don't know that I'm the right person to answer that for everyone. I am a person who is deaf, and there are other folks with different disabilities who would have entirely different experiences than I have. I hope Shawn also can think about his answer while I'm working on mine, and then it can get back to me and I can give a better answer after that.
Especially when it comes to the blind community. Again, just being prepared, having your office or having someone be prepared to serve a person who's blind. Again, I mentioned that there are not a lot of blind people in this world, but always being prepared to serve is always one key element in regards to access, right? Again, um, people think Braille is so outdated and antiquated, but it's not. That's another assumption that we have, and I think just being prepared to being attached to some company in the area who produces material in Braille, right? Because I know there's no Braille embossers in healthcare settings, but I would say just be prepared to serve and understand in each office that look, there's a possibility that someone will walk in this office who is totally blind, who's coming by themselves, right? We need to be prepared to serve them. I'll never forget going to a clinic in DC, a healthcare clinic, and the young man at the front said, I can't help you, right? And so when I refused to move, and I said, well, someone's going to help me, he went back into the back office and told his supervisor, and you can hear his supervisor yelling at him, saying, you better help him. We're not trying to be sued, right? So it's like, it's just having your staff prepared for one. I can't think of the other 2, but I think it's all about preparation. So.
Thank you.
Thank you, Shawn, for giving me some time to think about my answer. I appreciate you and your help. Soft skills are so lacking. The situation you just described about this person at the front desk refusing to help you, that's also just rude, and common sense would be to help a person check in or whatever it is. That's your job. So those soft skills lacking, maybe you don't have everything ready for every person who comes into your office. you can't necessarily be over prepared. And reality is you may not be completely prepared for every patient who walks in, but soft skills, connect with the person who you're working with, work with them, be transparent about where you are. That is so important. We get taught, white supremacy teaches us that we're supposed to show we have the right answers all the time. We don't. That mentality is built into our society, but has destroyed our society in many ways. It's okay to say, you know what? I don't know. I've never worked with a patient with XYZ before. I'm willing to learn. I'm ready to support. I'm ready to jump in. That goes a long way. Being willing to be vulnerable, and then the patient can work with you. If I could give one tip, maybe 2 in 1. I don't lie often, trust me. Speak directly to your patients, regardless of if they're there alone or someone else has come in, an interpreter or someone else who is a caregiver. Speak directly to the patient. The patient is the person who is here for their healthcare. Don't say, tell her, tell them. Directly connect with the person, with the patient. And sometimes as deaf people, it feels like maybe for a healthcare provider that the deaf person isn't watching them enough. They're looking at the interpreter. It doesn't matter. Talk directly to the patient. The other tip that can be very useful for folks with different abilities, disabilities, always communicate with the patient before you touch them for any reason, for any kind of examination. Say, okay, I'm going to touch your ear to check the inside of your ear. Good. Ask for consent. I think that's another key issue. And a lot of people with disabilities experience touch and access to their bodies without consent. They don't have bodily autonomy. A lot of folks with disabilities, regardless of the disability, get touched without consent. People touch them to try and fix something, to handle something, to adjust their clothing, to touch them for medical reasons. But you must allow for bodily autonomy for people to realize their bodies are theirs. And that is especially important for anyone who's experienced sexual assault, abuse, or trauma in their lives. If you start with saying, okay, I'm going to touch this area, is that okay with you? Any area, then that gives that person, that survivor, that patient, the ability to say yes, no, or I'm not ready yet. And then you have to be prepared to receive a no and go at their pace. I know that there are time requirements and you may be trying to quickly get through the appointment, but taking the time to connect with your patient makes an incredible impact. I can promise you that. And if that fails, you can find me and tell me I was wrong.
Hi, I had a specific question geared towards you, Shawn, or if you wanted to answer it, it's more about working with children and folks with invisible disabilities, as they would say. I've worked with a range of children who have mental disabilities, and because you cannot see them, sometimes there are moments where their behavior may be misinterpreted when they're in the midst of a crisis. And I think about here in the US, when we engage with law enforcement and emergency response systems, I want to know a little bit more about your experience working in those spaces, because it seems like the standard or the baseline is that when we engage with emergency response systems, the police may be the first to arrive. And if they don't have the training or the competency to be able to differentiate mental health crises versus criminal behavior, it sometimes I feel like more often than not, it ends up being detrimental to the folks who are calling for help, essentially. And even more so, under-resourced and Black and brown communities seem like statistically are the folks who suffer the most. And so I'm wondering if you could talk about what you imagine a collaboration to look like between public health professionals and law enforcement and emergency response systems. And that can be across any disability, both visible and invisible.
Now, personally, I have not dealt with that question you asked, but I know for a fact because I know there are programs out there where they've worked with law enforcement agencies, especially individuals with intellectual and developmental disabilities, those who are autistic, in regards to how to interact with them during a call. Let me just say this though. I'll never forget riding in the car, and my cousin had I busted tail light or something, and we were stopped, right? And this was where a time I used to wear shades, right? When I would, go out, I don't wear them anymore. And so the police officer assumed I was, being sort of smug and arrogant, because as he's talking to my cousin, I'm just off. I'm not paying attention. Well, I am paying attention, but I'm not engaging in what they're discussing, right? And I think the police officer tried to make eye contact with me, and then he sees my cane, but my cane is folded, right? So he's assuming it's a weapon, right? So I'm kind of reaching down for my cane, and he yells, "Don't move," right? And so my cousin had to tell him, well, he's blind, right? And so that kind of, surprised the police officer, right? But it's one of those things, and it gets back to your question about the collaboration. It's all about training, right? If you don't know, it will be detrimental, especially in Black and brown communities, right? If you're not understanding what autism looks like, right? How a person reacts when in a certain stressful situation, right? So I would just say personally, I haven't dealt with it from a mental health standpoint, but I'm well aware that there are organizations from a mental health standpoint and sort of a police agency standpoint that have worked together to address how to deal with individuals, especially who are autistic and have mental health concerns, I would say.
She doesn't need a microphone.
Bring it down a little bit. Our undergraduate and graduate programs, you talked about empathy and that is a soft skill that we need to drive in. Universal design, making sure that the health literacy, and I think for the public health people, that's a huge thing, is looking at health literacy and understanding that it needs to be in the language of your patients, that it needs to not only be in the spoken language, but it also needs to be at the educational language of your clients and their caregivers that they use. I, as someone born and raised in the DMV, want to apologize because, and have practiced, because one of the things that I preach all the time is we have excellent care for our blind, deaf and blind community. So to hear that that was a problem that you had definitely hurts my heart. I always advocate that we have an in-person deaf interpreter when I am treating my clients specifically at a rehab center and in the hospital for rehabilitation, and I've never had a problem getting that. So to hear that that was a problem definitely hurt my heart to understand that. But universal design, whether it is with the equipment that we give out, whether it is with the supplies like a CPAP or a dialysis machine, those things are key, and you all reinforced all of that. So I just want to say thank you for being here. Thank you, Nicole, for bringing this here. And thank you, public health students, for being here to hear it, because I think it's important for you all as well.
Let's say real quick, I mean, and this is not a medical situation, but I'm going back and forth with the Department of Motor Vehicles, right? In regards to my ID. When you go up, obtain a non-driver's ID, you have, if you want to sort of identify yourself in regards to your disability, they have some choices on there that you can select. They don't have one choice on there that says blind, right? Now they do have visually impaired. Now I personally hate that for me because I'm totally blind. Visually impaired often means you have some functional vision, right? So if again, I gave you the policeman story, right? If someone stops me and they look at my ID and it says visually impaired, they may assume that I have some sight. And of course, if I'm saying I don't, and they're reading and it says you do, especially in this climate today, then what, right? Also on the ID, on the choices of ID, it has hearing impaired. Now, I can't speak for the deaf and hard of hearing community, but I know some of them don't like that term, hearing impaired, right? So when we talk about systemic ignorance, and I'm going back and forth with the head of DMV, and he's telling me, well, I got to do some surveys and studies on, on the term, and I'm like, what do you mean you got to do surveys and study? I'm part of the blind community. I'm telling you, this is not a good term for us, especially for us who are totally blind. The idea I'm going back and forth, and I don't care if this is online or not, with someone from the head of DMV in regards to what I need to be called is ridiculous, right? And so I just want you all to just, we went to soft skills and empathy. I mean, that's all we ask for. Just having an understanding where we coming from, as persons with disabilities or those who are blind or deaf and hard of hearing.
Yep, that same. Right. We don't like the term hearing impaired either. And I think it's so ridiculous how people will say, no, we need data, we need surveys, we need all these things. No, you don't. You just are trying to keep us marginalized and outside of the group, and you don't want to invest any more money in us. And you would rather profit than have our presence. Basically, you're preferring profits over our presence. And I really just, I wish I could go on all night. But yes, I agree with you, Shawn. It is very frustrating. And I've seen in other countries as well, the push to shift to be more inclusive. I don't like the word inclusive. It bothers me. It just rubs me the wrong way. But being mindful of everyone who's at the table. And if someone's not there, who is missing? Who do you need to invite to be there? And I do see other countries becoming better, like the concept of universal health care is incredible. And in the US, they're keeping us down because they're profiting from us and profiting from our access needs. And they know that we need certain things for access. And even when we advocate for them, they're just focused on profits. I don't know. Right now, I feel like I'm not making total sense, but yeah.
You're making complete sense. Anything else? All right. Well, I have learned a lot tonight. I think everyone in here has learned a lot tonight. And I have my little QR code for those in the room that need that, for my students in here. So lastly, as we get ready to wrap up, I just want everyone to be more mindful when you do go into your profession, when you are already in your profession, those that are already in your profession working, because I know this is part of the DC Public Health Association annual meeting, and learn about another disability or something that you don't know, right? Learn how to incorporate it into, your language. Learn something new. right? So nursing students, public health students, OT students, anyone. Ask your professors, how would I deal with an individual with, who is deaf? How would I deal with an individual who is blind? They brought up a lot of good points that I didn't even think about, right? Just for me personally, learning about the interpreting services was a big thing that I had to learn about. When previously, before this, learning about the prevention on blindness services, that was a big thing that I learned about too. So yeah, so just another round of applause for our panelists. And I thank everyone so much, and I hope everyone has a great day. And that is all. Yes, one more question.
Saving cookies.
There are plenty of cookies, chips. Yes, when they first got up, it was like a herd. Everyone got up at one time. Yes.